Sammy, do you want to? Great. So welcome everyone to our June office hours. I'm Shoshana Levine. I'm the program director for the City Health Dashboard, and I'm joined today by Sammy Breslin, who's our senior project coordinator. We were supposed to be joined by a colleague of ours from NLC who had a family emergency and had to cancel on us today. So we are going to do our best to do her portion of the presentation. And we can also direct you to some of the National League of Cities, fantastic resources around ARPA, and kind of get answers to any of your specific questions around that through their resources as well. So we're happy to try, and we can of course answer any of your dashboard questions here today. So I'm going to start with a quick overview of the City Health Dashboard, including a demo of some of our site's features. And then Sammy is going to talk a little bit more about how the dashboard can be used for around the American Rescue Plan Act funding that's coming down. And then, we have a lot of time set aside for Q&A as well. But these are meant to be informal. So as we're going through, if you have any questions, feel free to either drop them in the chat, to raise your hand, if that's a feature here, or just to, jump in, and I'm happy to answer questions as we're going along. So I'm going to share my screen now. And you all can see our presentation. Great. Okay. So welcome to our City Health Dashboard virtual office hours. And so I'm going to start again, just kind of taking a step back and thinking about what the dashboard is all about. So our goal is really to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. And just from quick conversation before we started, we know that there's a lot of interest in data in this group, and just an understanding of how data can really be a powerful motivator for change. So the dashboard, we started talking about the dashboard and kind of thinking about this concept with some partners of ours who were doing work in communities, and we're finding that cities were really interested in working on health issues in their communities, but they didn't have the same kind of data on health as they did on factors like education or housing. And so they really couldn't put health at the top of their list of priorities. And from those conversations came the City Health Dashboard, which again, originally started out with 500 cities, and since April of last year now has been expanded to over 750 cities, with data on over 35 measures of health and the factors that shape health, and the drivers of health equity, really to guide local solutions. And so those are all cities over 50,000 population. And we really do have a range of measures that we'll get into in just a few minutes, but really trying to give cities a good understanding of kind of broadly what well-being means to their community. So again, we worked closely with partners, including the National League of Cities, partners at ICMA and the National Resource Network, and really wanted to make sure that this dashboard met the needs of our local constituents. So it was designed, developed, and tested by community and city leaders. And we have this ongoing cycle of improvements and upgrades that continues to get feedback from our users. In fact, we are going to be having some new features and some updates to the site just in early mid-July. So keep an eye out for that. And really, there's lots of things you can use a dashboard for. We can talk about some of those today. And I'm curious to hear if any of you all have used the dashboard before. But some of the primary uses are to compare health gaps across neighborhoods. And here you can see in Columbus, Ohio, census tracts that are just a few miles from each other, or people living in them live just a few miles from each other, but have over 20-year gap in life expectancy there. And so it's really striking when you can put these neighborhoods right next to each other and show those disparities. We also have the ability to compare your cities to other cities, really for benchmarking and thinking about guiding local solutions, and again, to set priorities and better target resources. So we have, as I mentioned, over 35 measures. I think we just added a new measure of broadband access. So I think we're up to 39 measures now, which is really exciting. And all of our data comes from national data sets. So you see in just a moment, some of our big data sets that provide a lot of measures are the American Community Survey, Vital Statistics, and BRFIS, the Places Project out of the CDC. And the reason that was important to us was so that our biggest cities, New York City with over 8 million people, has the exact same measures as Schenectady, New York, which has about 66,000 people. And so they have the same measures. They're comparable because they come from the same places. And we're not putting an additional burden on the cities to collect the data themselves. We make sure that all of our measures have rigorous methods underlying data collection, and we really want them to reflect public health priorities. So we're constantly looking and thinking about what are the most pressing issues of the day, and making sure that these data are really meaningful. They need to be amenable to city level intervention. We don't want to tell people there's a problem that they have no ability to impact. We make sure that they're updated regularly. So we update our data as soon as we're able to after the underlying data are released. So that means for most of our measures, they're updated annually, and you'll see you can get multiple years of data for many of our measures on the site. And we want to make sure that we stay balanced over 5 overarching domains. So here are those measures, and you can see here, so anything in blue is available just at the city level. So that'll be analyzed down to city boundaries. And anything in yellow is analyzed down to neighborhood boundaries. So that would be census tract as our kind of neighborhood boundaries within the dashboard. And you can see here health outcomes, clinical care, health behaviors. These are kind of what you might think of when you think of a traditional health measures on a health dashboard. But we also, again, want to give this very well-rounded view of what is a healthy community. So we have measures of the physical environment like air pollution, lead exposure risk, walkability, park access, as well as social and environmental factors, such as there's several measures of education, absenteeism, high school graduation, third grade reading proficiency. As I mentioned, we just added a measure of broadband connection, which is very important and timely right now. Poverty, housing cost, measures of diversity and segregation, and 2 different measures of unemployment there as well. So now I'm going to do a quick demo of the site. Unless there are any questions as I've been going through. Okay, so I'll pull this up here, and you can see it's a free public website. Anyone who has an internet connection can access all of the data here, and take a look at this homepage. We're actually, as I mentioned, we're going to be updating this in just a few weeks, so just a few more weeks with this specific look, but we are going to be adding a number of new features and improving navigation. So we really hope that is helpful to everyone. Pardon me. So we start here with, I'm going to type in my city. I'm going to start with Shreveport, Louisiana today. And we start typing that and you see it comes up. We can click on it. And here are all of our measures across the dashboard that we just walked through. And I'll click on our newest measure just as an example. And so up top, we have some information about the city. This is our navigation bar. So it shows you all the different features that you can access. and then some information about the measure that we're looking at. So the name, the years of data that are available. Most of our measures with multi-year data, we can go back a number of years. This one goes back to 2017. Some of them we can go back to as far as 2013. But again, it really depends on the underlying data set. And then some more information about the measure, getting a little bit deeper into the source, the years of collection, some tips and caution. We have a metric one pager for all of our measures that really gets into why we think these measures are important and how we calculate it. And then, the most interesting information would be all of the information about this measure for our cities. So here is our scale bar, and I'll just quickly go through this because it's kind of how we present data across the site. We have this gold bar represents the city or census tract value that we're looking at right now. So you can see the value for Shreveport is 52.6%. Compared to this is our dashboard city average of 72.4%. And then this blue check mark in a circle shows you kind of which direction you'd want to move to improve outcomes. So for broadband connection, a higher number would be better. But for something like diabetes, you want to move towards a lower number. And if Shreveport were doing better than the dashboard city average, there'd be a little green check here that looks like this. That would just kind of be a visual signpost for how the city is doing. We have the ability to download those scale bars and the map that I'll show you in just a second into these kind of nice high-res images that you can put into presentations or documents that you're preparing if you're interested in adding these data. So next, and this is, I think, my favorite part of the site, looking at these maps and being able to investigate what is going on within these cities by census tract. So, we saw up top that that Shreveport as a whole is doing actually a fair amount poorer than the 500 city average, or sorry, the dashboard city average. But even within the city, there are a lot of disparities, and you can see this at a glance just looking at this map. But if we hover over here, you can see that this neighborhood on the west side has a connection rate of 75.8%. Click on it and add it right there. Whereas this neighborhood that's right next to it is only 18.5. So that's a huge range there. And there's some even as low as 7% here. And then, back up in the 70s, high 60s as you go down here as well. So you can really dig into these data, pull out the census tracts, the neighborhoods that are interesting to you. Also, you can look at these data in a tabular format and kind of arrange those so you can look at the data however you're interested in. We also have the ability to look at the city overview, which provides a few different pieces of information in this tab here. You can get this snapshot of all the measures on the dashboard. So just kind of scrolling quickly through this, you can see how Shreveport is doing across all of these measures. But we can also see demographics for the cities. We provide some of that information as well, both in a tabular format as well as these demographic maps. And I'll just take another minute to show you these. These are a fairly new feature and really exciting to see. We have the ability to show maps by age group, and these are broken out into pretty broad categories, but we have, youth, adults, and then older adults broken out there. Or you can look at racial ethnic groups. And so we have we have kind of the big census categories for racial ethnic groups, but we also have particularly for Native Hawaiian Pacific Islander, for Asian American, and for Hispanic, the ability to get down into particular subgroups that you might not see kind of disaggregated. But when you're talking about Hispanic or Asian, there are these huge categories that talk about a lot of different people from a lot of different places with a lot of different circumstances and customs and context. So we have the ability to look at that, and we can see here the Central American population across Shreveport, and it really seems to be concentrated here, which is very interesting as well. So next, we have data broken down by demographic groups for about a third of our measures. We don't have it for this broadband measure, but we do have it for something like absenteeism. So you can see broken down by racial ethnic groups, and as well as gender, and Shreveport seems to be doing very well in this measure. We also have the ability to compare cities in two different ways. We have, while this is loading, we have a, sorry, this sometimes takes a minute when I'm also screen sharing in Zoom. But as this is loading, we have a search bar that allows you to type in a city that you're interested in. So if Shreveport wanted to compare themselves to New Orleans, we can start typing here and find that city, and it would add New Orleans down here to the list. But if maybe they weren't sure who a good comparison was, perhaps they're always compared to New Orleans, they don't like that comparison, we can also find maybe some more relevant cities, some more relevant categories for Shreveport, perhaps by population size, by region, and you can see these numbers kind of dropping as we go through. And we find a number of cities that that might be more relevant for Shreveport as a comparison. We also have the ability to compare metrics, and this is available for our measures that are broken down by census tract, which absenteeism is not. So I'll just change that back to broadband connection. And we can add another measure in here, perhaps life expectancy. And we present this information in two separate ways. First, a metric comparison map, where again, the darker colors tend to indicate poor outcomes, and lighter colors are better outcomes. So you're kind of looking just kind of getting that visual sense for what's going on here. And you can see it looks like in a lot of these census tracts, the darker blue also goes along with the darker red dots that show shorter life expectancy. And we see here as well in the scatter plot, there seems to be a correlation here. And, we want to make sure that we're not kind of having any causal relationship here. There's probably increased broadband connection isn't causing people to live longer. There's probably some underlying factor that connects these two. I can think of a number of potential culprits there, but we can see that they move together, and we can maybe start exploring how they might be impacted by other factors. And then we can also click into any of the dots and see the data there. And just two more things to quickly show you. First is our take action section. We were just talking about this. And this right here, if you access it through this navigation bar up here, it'll be automatically filtered for whatever measure you're looking for, but we also have it accessible through this menu here, or take action section that you can explore it as well. But if you click on find programs and policies, you'll find for broadband connection a number of programs and policies, as well as kind of some more supports around how to take action in your community. So thinking about partnerships, exploring strategies, finding funding, and measuring impact as well. And finally, just really quickly, wanted to show you also the data access page, which if you've never visited before, you will have to fill out a quick survey just so we can kind of keep track of how many people are downloading our data and maybe what they're using it for. But this allows you to access our data through an API where you can pull all of our information, or through downloadable CSV files. So you can download our entire data set or all the cities in your state. And through our API, you'll get, again, all of our data points. So all of the years of data through the downloadable CSVs. We're only able to provide single years of data for all of our measures because those would get to be huge and unmanageable data files. But we are able, if you have a particular need or desire, if you reach out to us, to provide kind of custom cuts of data here. So I know that was a lot of information. And before I pass it over to Sammy, any questions? There's a lot more we can do with this site, but that's just a very quick overview.
Yeah, sure, Shauna. We had a few questions come through the chat.
Okay.
The first one is, how are the cities chosen for the dashboard? When we first started in 2018, the cities that we chose were aligned with the CDC's 500 Cities project. So that was any city any city that was also a census designated place, which is a very specific census terminology or a census term. That was also 66,000 or higher, but it also included 3 cities below that threshold to make sure that all states were represented in the data set. So I think that was, there was one city in Vermont,
West Virginia and Wyoming.
Yeah, West Virginia and Wyoming, just to make sure that we had 50 states covered on the dashboard, at least one city per state. And then we had a question, and then 2020, we expanded our site to include any city or census designated place with a population of 50,000 or higher. So that increased our kind of city count by around 250 cities. So now we have 756 cities on the dashboard. Then please define census tracts and how using census tracts might be beneficial. Another great question. Census tracts are statistical units that the US Census uses to measure various things. All of our metrics, so broadband connection is measured. We call it, or these are all census tracts that are seen here on the map, but in many cases, they approximate neighborhoods. And so we use those terms interchangeably. There definitely is some nuance there that I'm sure Shoshana might be able to
Yeah, just adding that, as Sammy mentioned, these are really they're statistical, government units. So in a lot of cases, they don't necessarily align with how individuals living in communities see their neighborhoods. So it's kind of the best we can do without going to 750 plus cities and asking them, what are your neighborhood boundaries? Like, how would you draw the neighborhoods in your city? And honestly, in my area where I live in Brooklyn, if you ask 10 different people where the neighborhood boundaries are, you'd get 10 different answers. So we really kind of just needed an easily accessible, standardized way of drawing neighborhoods. And census tracts tend to be about 4,000 people. So yeah, kind of depends on a few different factors, but they're about 4,000 people. And again, standardized across all, actually all counties, all cities, just across the US, they're standardized. And they're also used by a lot of the data collection agencies as kind of a neighborhood approximator.
And just to add, I just dropped a link to a blog that we wrote about this very thing back in 2020, or at this point 2019. And so we explain all of these questions that you're asking, Angela, about neighborhoods and how many people live in census tracts and all of that stuff. So I definitely recommend checking that out. And then there's one last question, which I think we should be able to answer, but we might not be able to without an analyst on the call. Could I use census tracts to help me correlate with elementary school boundaries? I'm going to say no.
So if you had So that this would be a great project for, downloading
Yeah.
our underlying data. And when you download the data, you do get all of the geographic files and all that as well. If you had the the elementary school boundaries, you could overlay them and kind of see how they intersect or overlap. But those are really determined by localities and are really specific to cities. So we can't really say, city by city whether those would really approximate each other.
And that is the last question in the chat, unless anyone has any other questions about the dashboard that they can, feel free to just speak, or again, drop it in the chat, and then we can either get to it now or we can wait until the end. Okay, not seeing anything come through, so I will share my screen. And let me just make this larger. Okay, and everyone can see my screen? Great. So as I'm sure everyone on this call knows, Congress passed and President Biden signed into law the American Rescue Plan Act earlier this year, which is a $1.9 trillion federal funding package that is going to deliver economic relief for industries, American workers, families, and those most impacted by the COVID-19 pandemic. And there's about $350 billion that are going towards local governments. And, as of May, this funding started flowing into the hands of those governments, who now must prioritize and allocate and distribute this funding towards local projects. And the government or the administration has kind of outlined pretty broad, but 5 eligible categories of ARPA funding. So the first one is for the public health response. So this is for local governments trying to address COVID-19 through vaccination programs and ongoing testing, but also other public health emergencies that might be arising over the next few years. The second category is economic hardship. Responding to those individuals and those communities and those industries that have been most impacted by the wide sweeping economic devastation that we've seen this last year and a half. And I do want to mention that across all of these different categories, but particularly the economic hardship one, there is specific guidelines towards integrating equity into any local solutions, any projects that the government will be funding towards. So really baking that in and baking equity into this response and recovery is really key for the administration. And then the third category is making sure that those who were performed essential functions over the last year, but also just generally those who are in essential industries, healthcare workers, food service, grocery workers are getting compensated for that work and for really putting themselves in harm's way during the pandemic. The fourth category goes towards replacing public sector revenue, which was lost over the last year and a half, but also will help to offset or make sure that governments can continue providing services, programs, policies to keep government and kind of running as they should, and keep programs and social services getting delivered as they should, while, so they don't have to cut back because of the reduced revenue. And the fifth category is for water, sewer, or broadband infrastructure. And the administration really wants to focus not only on improving things like bridges and roads and highways, but the lack of access, or the importance of high-speed internet has really been exposed during the pandemic, and how important having access to internet is for the normal functioning of everyday life. And so investing in improving broadband internet access is really, really key for the administration. And which is, we, as Shoshana mentioned, we added a measure of broadband just this month. So this data that we've provided can really be useful and beneficial for cities looking to craft programs, implement policies aimed at that. And how can data support ARPA spending, and specifically dashboard data? For a lot of the cities that are more mid-sized and smaller, this is the first time that they're getting an influx of this amount of money. And we all think, oh, if only we had more money, like we could do whatever we wanted. But when you actually get so much funding that you're not used to, it can be overwhelming and hard to figure out how to spend it, where to spend it, and data is really, really, really key for helping cities do this and helping governments do this, especially when they don't necessarily have the capacity or resources to collect the data or analyze the data themselves. So, resources like what we provide are really, really beneficial. And I'm going to go over just 3 examples of how our data can be useful in helping cities allocate their ARPA funding. And I've kind of used, little case studies that are that we've created to kind of hone in on these points. So improving outreach to specific communities and populations. Shoshana mentioned and kind of showed you guys our demographic maps that we provide on the dashboard. And, we have, so, using those maps, city leaders are able to see, the demographic makeup by race, ethnicity, and age of their neighborhoods. So in the case of Jersey City, which I've highlighted here, community health workers at the health department working to increase COVID vaccination rates in Latino men can access their city's demographic by census tract maps, selecting Hispanic to better understand which neighborhoods have larger Hispanic populations. And then using that information, they can work with Latino-led community groups in those neighborhoods to provide more targeted outreach, maybe translate vaccination resources into Spanish, and provide ongoing testing support instead of a broad citywide effort. As I mentioned before, a lot of city revenue was lost during the pandemic. So being able to really target and hone in on the areas of need, and being able to be really specific in how we use our resources is so important now and moving into the future. And then example 2 is connecting more households to broadband internet. As I said before, internet connection is a core part of our daily life, whether it's for virtual learning, paying bills, finding a doctor, ordering groceries. We really need access to high-speed internet, and our broadband connection metric identifies those neighborhoods that are struggling to access that public resource, or what should be a public utility at this point. And I pulled up broadband connection in St. Petersburg, Florida, and in that city they have a public-private partnership that was formed in early 2020, even before the pandemic, but they are working to increase access to online resources as well as training, tools, and support required to use that access in a more meaningful way. So that partnership consisting of local government, businesses, nonprofits can use the dashboard measure to, they're looking into pilot programs of providing internet services with affordable housing. If you live in affordable housing, your rent can go towards providing or towards receiving internet service. So they can really target, potentially, affordable housing units in these high need neighborhoods with that program. And what they're seeing is that, at least in St. Petersburg, It's not necessarily a lack of infrastructure in their neighborhoods. It's more a lack of access to that infrastructure. The wires for internet are all laid, but it's not really affordable for a lot of their residents. So they're looking into how can we maybe supplement or partner with service providers to reduce internet, the cost of internet in those neighborhoods. And then, example number 3, linking rental assistance to those who need it most. Even before the pandemic hit last March, millions of Americans were struggling to find safe, affordable housing, and COVID-19 has really laid this system in crisis, laid bare this system in crisis. And the dashboard provides a measure of excessive housing costs, which identifies communities spending more than 30% of their incomes on housing related costs. So costs like rent, mortgage payments, utilities. If you're spending more than 30% of your income on those things, on those expenses, you are considered rent burdened or housing cost burdened. And that information is really helpful for cities, for example, like the city of Hialeah, Florida, who are trying to offer emergency assistance to tenants and landlords, and they've created these trainings to help people apply. So, government actors in that city can really target those trainings and target that outreach towards these high risk neighborhoods, and really make sure that they're getting the uptake that they're hoping for in households or in residents applying for this emergency funding. And I do just want to mention that these examples are all hypothetical, though a lot of the work that is being done in these cities is true. Then the use of dashboard data is more of a hypothetical in each of these cases. And so that is my last example of how the dashboard can be used. We definitely want to hear from the folks on this call, if you have that information or if you are part of those conversations, what is the priority in your city of, the government's, funding or the allocation of the ARPA funding? Are there any pain points? So I will open it up now for questions, comments, concerns. Oh, great question. Is the PowerPoint available for download? I can definitely send around the PowerPoint if that's helpful to the folks on the call. We do record the virtual office hours and post those on our website. I can pull up that link and put it into the chat as well. And so those are posted about a day or two after the virtual office hours. So the recording will be on this page that I'm just putting into the chat right now. But I can also make the PowerPoint available as well, if that's helpful.
Sammy, are you able to just say maybe a sentence or two about the National League of Cities resources around ARPA?
Yes, and I can also drop a link for that as well. So the National League of Cities, during the beginning of the pandemic, really put together an amazing kind of trove of resources to help local governments, especially small and mid-sized cities, in their response to COVID-19. And as the pandemic has evolved, they've started shifting towards recovery and rebuilding, and have a lot of different resources for cities on looking to spend this ARPA funding. So they have a whole bunch of webinars that they're hosting, I think at least once per month, providing support to cities on how to use this funding, and having representatives from the administration, from the Treasury Department, to answer questions about eligible uses of the funding. They also have a great they have a form to submit questions about how you can use the funding in the city. Again, questions about just pain points around using the funding. And then they have a whole part of their site dedicated to kind of providing answers to those FAQs. They also have stories and little like little case studies about what certain cities or governments are doing around broadband, around equity, so you can learn from peers in other cities. I think that's about it. I will get that link up in the chat.
And while you're doing that, Sammy, I can answer the next question that's in there.
Great.
So it's a question asking how to link two or more metrics together. And unfortunately, the example there is uninsured and demographics. And we actually don't have the ability to link our demographic maps to our metrics. And that's it's something that we talked about and we really wrestled with and ultimately decided that, you know, there's you know, we're not in any way showing causality when we put two metrics together. And so we really just thought that there was the potential if we kind of link to the demographic group to a particular measure, you know, kind of implying some causality within those the measures and the groups. And actually, I don't think those demographic data are available for download. They are just pulled from the American Community Survey, so they are fairly easy to access on your own. But I can show you here. I can show you how to compare two measures if you're interested in that. So again, we're in Shreveport looking at broadband. If we click compare metrics, we can maybe do broadband connection and uninsured. So we can look at those two measures there. And it's just, you know, you can kind of toggle between which ones are most important to you within this compare metrics tab here. And we can look at that map or that scatter plot there as well.
And then Shoshana, we have another question, but we can download the data and compare it to ourselves. So,
yeah, I just mentioned that.
Oh, is that the one that you were talking about?
Yeah, the demographic data is not in the downloadable files, but the measures are.
Any other questions? I'm not seeing anything in the chat.
The demographic data, if you want the source data, it all comes from the American Community Survey. So there's the fact finder that you can access the data there. And if you're having trouble navigating it, it's not the most intuitive tool. Feel free to reach out to our team. And Sammy, if you want to drop that email address again into the chat, if anyone has any questions about that or kind of anything else dashboard related, we're more than happy to answer them. And Sammy, or not Sammy, actually, we have a new person on our team who is monitoring that email account, but it does actually go to a live human and gets monitored regularly. Well, great. If we don't have any more questions, we can hang out for a few more minutes. We're so glad you all joined today. And we're available if you have questions.
Thank you so much. That was a really good overview to refresh. And I see how maybe, I understand that you can kind of interpret data any way you want to show different things. And, but I guess as I'm looking for the number of uninsured children in a neighborhood, that is going to be helpful information, especially as we combine maybe uninsured and undocumented children and things like that, where we can show a need for access to health services in a school. I think that would be kind of helpful. That's some of the things that I'm looking for. And even if we mix that with like I say, COVID vaccinations too. The schools are a place that you can give vaccines. So, okay, I really see how we can use the information. I just wish we had a few more cities.
And sorry, where are you joining from? I missed that in the beginning.
Utah.
Utah. Great.
Actually, in my county, which is in Davis County, which is suburban,
Mhm.
there are excellent resources for other cities that that I am sure we can access and I can share with others so
Great.
that they know about the resource.
Well, great.
Okay, well, thank you very much.
Thanks for joining.
So the PowerPoint, would you put it in the,
Yeah, you obviously registered, so I have your email. I can shoot it over to you after this call. And again, I will also post the recording online probably tomorrow or Thursday.
sounds good. Thank you so much, Samantha. Thanks, Shoshana.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.